Hello, and welcome to another anaesthesia step-by-step tutorial. Today we're looking at hypoxia and how to go about fixing it. So you're in theatre, tending to your beautifully anaesthetised patient, and the surgeon is 5 minutes into their operation, when you hear the dreaded sound of the saturations dropping on the monitor. What do you do, and where do you start? Well, first thing I do is look at the trace on the monitor. If the trace looks like this, then the probe has either fallen off the finger because the surgeon's leaned on it, or it might be on the same side as the blood pressure cuff. However, the trace still looks good, then it's more likely this is a genuine desaturation. The first step is ensuring you're actually delivering enough oxygen to the patient. This involves rapidly checking the pathway from the anaesthetic machine all the way along your breathing circuit to the patient. It doesn't matter which order you do this in, either direction is fine as long as you don't miss any components out. So the first thing you do is switch the oxygen to 100% and increase your flows to buy as much time as possible. Just make sure that you adjust the vapour concentration if you've been using low flows. Check the bellows are moving or the bag if the patient is spontaneously breathing, and inspect along the breathing circuit looking for disconnections or blockages. It's not unheard of for there to be a giving set cap lodged in the angle piece just to keep things interesting. The second step is to check that this oxygen is actually getting into the patient's lungs. Check your tube length at the teeth to ensure it hasn't migrated into the right main bronchus, and have a look at your CO2 trace on the monitor. A normal looking trace confirms there is a patent airway, while an abnormal trace can give you more information as to what the problem might be, such as an obstructed tube or a patient trying to breathe against the ventilator. You can also isolate the patient from the ventilator at this point, ideally using a separate self-inflating bag or using the bag and the APL valve on the machine itself to ensure that the problem isn't with the ventilator itself. Once you're happy with the airway, you can move on to breathing. Auscultate both sides to confirm you've got bilateral air entry, and you can also listen for wheeze that might suggest bronchospasm or potentially early anaphylaxis. You can also look at your monitor for current airway pressures and tidal volumes that may give you useful information as to the cause of the problem. Now's a good time to think about giving the patient more muscle relaxant, especially if the cause might be dysynchrony with the ventilator, and it will also reduce the oxygen demand of the respiratory muscles as well. Finally, remember that a SATS probe depends on peripheral perfusion as well as oxygenation of the blood, so check for deranged heart rate and low blood pressure. Be mindful that cardiovascular instability can be the cause of hypoxia, but also the result of hypoxia. A dash of vasopressor is rarely a bad idea in this situation. The most important thing to remember is when do you need to call for help. At the beginning of your training, you'll have a senior with you at all times. However, once you start anaesthetising independently, you'll need to figure out when it's appropriate to ask for more support. Ideally, you'd have at least checked that the SATS probe is positioned correctly and increased the oxygen concentration and flow rate before calling for help, but it's far better to call too early than it is too late. Frequently, the cause of this kind of desaturation is a combination of derecruitment, hypoventilation, or desynchronous ventilation in an inadequately relaxed patient, or simply that the patient's oxygen demand was higher than the low-flow settings were supplying. But if you're in any doubt at all, grab a quick reference handbook and follow the protocol to make sure you don't miss anything. That's all for now. I hope you found this anaesthesia step-by-step tutorial useful, and please do subscribe to be updated as new videos come out.